Good morning, everyone. It's Steve Murray, and it's day 3 of the series I want to do on from looking at the World Health Organization's guidelines, and we're talking at the moment about chronic disease. Yesterday we spoke a little bit about hypertension, and today I want to deal with diabetes. Now, diabetes I'm going to do in 2 parts because it can be fairly complex. So I want to keep it nice and simple and break it up into parts. So today we're going to talk about the condition itself and some of the exercise considerations and recommendations. So real quick, this is certainly by no means a lecture of any kind. There are really 3 conditions here in the group that we would refer to. So type 1 diabetes, type 2, and then pre-diabetes. So let's start with type 1. Type 1 diabetes it's an autoimmune condition. We know that today. And type 1 diabetics, you are diagnosed typically very, very early on in life. Because what happens is you have an autoimmune destruction of the cells that produce insulin in the pancreas. Now, type 2 diabetes, by the way, we also refer to type 1 as insulin-dependent diabetes, because without the pancreas secreting insulin, creating insulin, then you have to supplement that insulin, otherwise the person would die. So it is insulin-dependent as well. So type 2 diabetes, very different. This is a lifestyle-related condition. And it's essentially over a period of time, driven by lifestyle factors, you'll find a greater and greater insulin resistant skeletal muscle, tissue, liver. You find that the body becomes more and more insulin resistant, which means that you would ultimately be in the same position as a type 1 diabetic requiring insulin, because your body becomes more and more insulin dependent on the insulin you produce. And then pre-diabetes is really just exactly what it says. It's a condition that's characterized by high blood glucose. So when you take in food, particularly carbohydrate, you have this rapid spike in blood glucose. So we talk about, impaired glucose tolerance, or IGT, or elevated blood glucose. So you can test them in different ways. But that's really the sort of group. From an exercise perspective, however, all 3 are really important. So exercise is really important in all 3 of these. I want to say this: the longer that you, talking specifically about type 2 diabetes and pre-diabetes, the longer that you allow yourself to be in that condition, so in other words, pre-diabetic moving on into type 2 diabetes, the harder it is to reverse and the more difficult it is to treat. So remember that. So if you really want to avoid getting into this in the first place, and these are absolutely avoidable. So type 2 diabetes, pre-diabetes, and type 2 diabetes are absolutely preventable. They are absolutely treatable. That's something I really want to state. And I think, traditional medicine and the existing chronic disease medication model is flawed. But there certainly is the scenario where we can reverse type 2 diabetes and we can reverse pre-diabetes, no doubt. But the longer that you are that you allow yourself to be in that condition, then the harder that journey is. Okay, so the goal around diabetes is super simple. What you have to do is manage this glycemic it's glycemic control. That is really what lifestyle management of diabetes is. You must control blood glucose, and diabetes it requires a multifactorial program. Exercise on its own is not enough to manage these conditions. You really have to take diet into consideration, because it's a massive part, obviously, of managing the conditions. So lifestyle management must include all of the sort of key lifestyle factors: diet, exercise, and cortisol or stress control, which also has its own role to play in blood glucose. So what you really want to avoid is diabetic complications. I remember when I was down and I worked down at Sports Science Institute, you know, Prof. Noakes used to say, once a person starts taking insulin, type 2 diabetic starts taking insulin, the clock starts on when that person will die. And unfortunately, diabetes is the morbidity, that morbidity curve can be really unpleasant. Things like blindness, things like gangrenous limbs, and so you see lots of people with amputations and that kind of thing as the disease starts to progress. All right, let's talk about the fun stuff. It's much cooler. So this is different to hypertension, for example, because what the data tells us and the research tells us is that you need to place a greater emphasis, I'm talking about aerobic activity now, on vigorous intensity exercise. So if you're trying to improve your cardiorespiratory fitness, and you don't have, contraindicated conditions like uncontrolled hypertension, for example, then it's better for you if you have pre-diabetes or diabetes that you're exercising at a vigorous intensity and not necessarily at a moderate intensity, because we see better glucose control when you're involved in vigorous intensity exercise training. So that means things like HIIT, continuous training, intervals, fatigue training, all of those kind of things come into consideration when we talk about exercising with diabetes. Here's an important thing though. In type 2 diabetes specifically, it's important that you don't go more than 2 consecutive days without aerobic exercise, because that's really where the power of physical activity comes in and manages the severity of the condition, or starts to obviously treat and reverse. So you don't want to be going for more than 2 consecutive days without exercising. Just remember that if you are a diabetic or looking at pre-diabetes. In terms of resistance training, exactly the same thing. It's super important for everybody to include, but particularly important for diabetics. So resistance training must be done. It's super important to do that. But the contraindications like uncontrolled hypertension and other things, so if you are going to start an exercise program of any kind, it's really important to get some really good advice from an exercise medicine accredited fitness professional, an exercise physiologist. Certainly you can reach out to us, but making sure that if there are any contraindications to exercise, that we know what they are, what they are, and that's been taken into account when it comes to your program. Another thing that the data seems to tell us is that it's probably a good idea that if you're combining your training, in other words, doing aerobic and strength training in one session, that you do a resistance training prior to your aerobic training, because that seems to lower the risk of this hyperglycemia or low blood sugar, which can actually be quite gnarly and dangerous. So a good idea, do your strength training at the beginning of your program and not at the end. All right. So coming to exercise dose. So this is one of those things where we say, and you think about medication, I said it in my talk as well, the sicker you are, often you have to take more medication. And this is very much the case with diabetes. So if you have a look here in terms of all of the conditions, so for a healthy person, around about 8.7 kilocalories per kilogram of your body weight per week. For a diabetic to see serious improvements in health outcomes with physical activity, 36.8 kilocalories per kilogram of your body weight. So take your body weight, multiply it by 36.8, and that will give you the amount of kilocalories expended by exercise alone for that session. All right, so tomorrow I'm going to deal with specifically medications and safety considerations around diabetes. Have a good day, everybody. And once again, ask questions in the comments below.